Preview.
Recovery of decompression illness in spite of delayed treatment by Marty McCafferty. Any symptoms after a dive, whether you suspect they are diving related or not, should be evaluated. And this case illustrates just that. The diver was a 60-year-old female with more than 40 years of diving experience, including many years working as a diving professional. She was reportedly in good health and took no regular medications. The diver had made a total of 10 dives over a 5-day period. On the 4th day of diving, she participated in a single, planned decompression dive. All the other dives were within her computer's no decompression limits. The decompression dive was to 33 meters for 25 minutes. The breathing gas was air, and she met all of the necessary decompression obligations. There were no reported problems or incidents on that dive. However, 7 hours after the decompression dive, she developed numbness and deep pain in her right arm and leg that radiated into her foot. The feeling was unlike anything she had experienced before. The next morning, she participated in 2 further dives, the first to 13 meters for 50 minutes and the second to 9 meters for 30 minutes. The diver did not recall that any of her symptoms changed during these dives. However, the symptoms did start to worsen during a flight 48 hours after the final 2 dives. After the diver arrived home, the pain increased enough to wake her from sleep, and she took anti-inflammatory medication, which did provide some relief. But by morning, the pain was radiating into her right shoulder. The grip strength of her right arm seemed to be decreasing, and there was numbness and pain in her right leg and foot that were hampering her ability to walk normally. She decided to contact Dan. After gathering all the pertinent information, the Dan medic strongly recommended that the diver go to the closest emergency department for evaluation. The diver, however, felt that her primary care physician would be able to see her sooner, and the caller scheduled an appointment early in the afternoon. The Dan medic then contacted the hyperbaric chamber, as it seemed likely that the diver would be treated for decompression sickness. The attending hyperbaric physician spoke to the diver and asked that she call him while seeing her primary care physician. The hyperbaric physician and primary care physician worked together to arrive at a likely diagnosis. After performing a full neurological and physical evaluation, the physicians agreed that the diagnosis was that of neurological or type 2 decompression sickness. For treatment, she was transferred to a hyperbaric chamber, which was 2 hours away. On arrival, she was re-evaluated and treated in the chamber on a US Navy treatment table 6, which is about 5 hours. The treatment provided some improvement. Prior to treatment, the strength of her leg and arm had been measured as 3.5 out of 5, but after treatment, the strength was up to 4.5 out of 5. The next day, she received a further US Navy treatment table 5, which is about 2 hours and 15 minutes. After this treatment, there were only some mild residual symptoms of soreness in the right leg. The treating doctor explained that this was quite common and would resolve with time, which it did. This case highlights several things. The first involves symptom recognition. We should remember that pain is our body's way of telling us that something is wrong, whether we've been diving or not. Now, not all pain after diving indicates decompression sickness, but it should prompt an evaluation. If you have any symptoms that are new to you, seek medical evaluation or contact Dan to discuss the situation. This diver fortunately experienced a complete recovery despite the 5-day delay in treatment after symptom onset. We have found that divers still benefit from hyperbaric treatment after even slightly longer delays. How long the longest delay would be is a matter of discussion between hyperbaric experts, but cases that have been delayed as long as a month have been reported. The patient ideally needs to be evaluated and treated as soon as possible. And certainly, if possible, that should be within the first 24 hours of symptom onset. With time, the gas bubbles that cause decompression sickness, of course, gradually resolve. It's not known exactly how long that takes before they completely disappear. It is clear, however, that once they cause an injury, symptoms may persist longer than the bubbles themselves. If hyperbaric oxygen has been delayed for days, however, it may still be beneficial, but at this stage it's unlikely that the bubbles are the primary problem. Instead, the treatment addresses the remaining injury. If you experience symptoms, please do not hesitate to seek medical evaluation. For emergencies, contact the emergency medical services if these are readily available locally, and then contact the Dan Emergency Hotline. We're available 24 hours a day, 7 days a week. Your safety is our priority.